I had a normal full-term pregnancy, very healthy as far as we knew. We were kind of watching the clock, trying to get home after the first several hours, and just saw a few red flags, things that we thought weren't quite right. About 24 hours old, there were some further testing that was done, and sure enough, those concerns we saw a little earlier on, did present themselves, and we were immediately rushed to surgery. Turns out our son had a perforated bowel and was septic at the time, and so what that means is he had a pretty severe infection that he had been battling, and so he was about a day old then, and went into pretty challenging surgery that we were unexpecting, obviously, and so that kind of opened our eyes to a whole nother world at the Women's Pavilion and the NICU as well at TMH. When you're in that moment, it's hard to think straight. You don't know what's happening. There's so much information thrown at you, so much medical terminology, and they really lay it out to you. No question is a silly question, no matter how many times you've asked it or how many times they've said this at 2 o'clock in the morning or whatnot. But they were just there for us, 100%, 110% of the time. To the point where we were scared to leave them because I didn't want to be without them for all those questions and just holding my hand through everything that we were going through. They were angels. They became some of our closest people. We still think about them. We still keep in touch with them to this day. They laughed with us. They cried with us. They forced me to hold my son for the first time when I was terrified. I just knew if my husband or I had to step away, then they were, that my son was in the best hands. And they really became part of our family within those 2.5 weeks that we were there. Not only to just my immediate family, but my parents and my husband's parents, all the grandparents, got to know the nurses and the staff there, and just you can't thank them enough.